Today I'm going to share some information about the Romani people and their beliefs in death and dying. The Romani are traditionally an itinerant people who trace their roots back to the northern regions of India, which is present-day Pakistan. They are often referred to worldwide as gypsies, but this word is considered a racial slur and is felt to be very offensive. The word gypsy originated in the Middle East as a derivative of the word Egyptian, because the Roma people were believed to be descended from Egyptian lineage. They refer to themselves as Romani, with an I or a Y at the end of the word. Worldwide, there are believed to be close to 15 million Romani people. They live mainly in Europe, in the countries of Slovakia, Bulgaria, Romania, Poland, Greece, Hungary, and the Czech Republic. There are Romani people everywhere, but the countries named have the highest concentrations. The Romani began emigration into this country as early as the 1860s. There are an estimated 1 million Romani in the United States today, and they consider themselves Romani Americans. The Romani language is made up of many dialects, depending on the country in which their families reside. Some of Romani speak several dialects, and there is no standard or traditional right dialect. Traditional Romani place a high value on family, maintaining virginity and marrying young. The woman takes her place in her husband's family, attending to the care of her children and her in-laws' needs. Hindu purity beliefs are held, with the lower body below the waist and the upper body above the waist being considered separate areas. This is especially important after puberty, when the area below the waist is considered impure. They believe that contamination can occur if hands are not washed after touching the impure areas. Religious beliefs can be Hindu, Christian, Protestant, or Islam, depending on the migratory history of the particular families. Music is extremely important in their culture, with variations due to the countries their families traveled throughout. Romani people struggle to maintain and revive their culture while attempting to integrate and blend into today's society. The Romani people have endured persecution and misunderstanding in all countries in which they have settled. Because they are historically a migratory population, they are heavily discriminated against. Their dark skin, bright clothing, and beliefs have also made them targets of alienation. In Europe, they have been persecuted to the point of ethnic cleansing and were victims of persecution during World War II. Romani people were the second largest group killed due to racial discrimination during the Holocaust. They were believed to be racially impure, and their deaths numbered close to 1.5 million. They still battle human rights violations today in the form of discrimination, harassment, personal crimes, and high levels of underemployment. An individual's response to death and the ceremonial aspect will vary greatly from culture to culture. As we focus our attention to the Romani culture, it is very apparent their beliefs and rituals concerning death are quite different from those of the Western world. Romani people believe in Devla and Bang, which are God and the devil. Some people have adopted and practiced Christianity, paganism, and Hinduism in their host country, but their underlying belief system and indigenous religion and worship remains preserved. Romani believe the dead will come back to haunt the living, especially if the relationship was difficult or conflicted. All friends and family gather at the bedside of the dying person out of compassion as well as to beg forgiveness. Bereavement and death are greatly feared in the Romani. Discussing terminal illness such as cancer is avoided. Death is considered unnatural and senseless, cursed and contaminated, and the dying person should be angry. One must not die in a habitual place such as the bed or in a home. A public display of tears and lamentations are observed, with an increase in tone and intensity as time goes on, peaking when the coffin is placed in the ground. Mourning is intense, and all other activities cease, including personal care such as bathing, shaving, or combing the hair, as well as other distractions. Food is not prepared. Only drinking coffee, brandy, or liquor products are allowed. Mirrors and water containers are covered. Touching the deceased is prohibited. To prevent evil spirits from entering the body, beeswax is placed in the nostrils of the deceased. White and red colors are worn by the mourners to symbolize purity, protection, and good luck. Red symbolizes blood, a source of vitality and life. It is customary to avoid saying the deceased person's name. Feasts are held at different times throughout the year to declare the mourning period has come to an end. In the past, the Romani have unfortunately had a high infant mortality rate. This has recently improved due to more women giving birth in hospitals, although prenatal care still is often lacking. The Romani often take precautions to protect the life of a child beginning at birth. Newborns are immediately swaddled and handled only by the mother. She will often avoid green vegetables and tomatoes to prevent colic. In the first few weeks of the child's life, no one is allowed to go in or out of the home. Windows and doors are kept shut to prevent the spirit of death from entering and harming the baby. If a child dies despite precautions, this creates bad luck and the baby's body is avoided. The baby is buried in a secret place by grandparents, or the funeral and burial is left to hospital authorities. The Romani population is diverse with a vast variety of tribes. They may not share the same physical features or all customs, though generally the Romani have a distrust of health services and will at times lack adequate health coverage, leading to many Romani patients only seeking medical services for emergency treatment. The Romani have an increased rate of chronic conditions such as heart disease, hypertension, and diabetes due to their lifestyle, genetics, and lack of routine preventative medical care. Lifestyle risks include smoking and obesity. 85% of Roma smoke, as well as 85% of Roma being obese. Their diet is typically high in sodium as well as high in fat. The average life expectancy of a Romani person is only 48 to 50 years in the United States. It may not be uncommon for Roma patients to request older physicians or nurses, or those who had cared for them during previous visits, and they may not agree to be seen unless they are being treated by their specific caregiver. Due to negative stereotypes persistent in the media and a lack of understanding of Romani beliefs, many healthcare workers have labeled the Romanis as rude, demanding, and non-compliant. When seeking treatment, they will often delay being seen until immediate care is needed. Romani often come to the hospitals with their extended families. It is not unusual for camps to be set up on the hospital grounds or in waiting rooms. Family members often expect to be at the bedside 24 hours per day. The patient may become fearful if separated from their family. When providing personal care to a Roma patient, it is important to be aware of their concept of cleanliness and what is considered unclean to them. It is generally believed the upper half of the body should be kept separate from the lower half, as the lower half of the body is considered unclean due to bodily secretions. They will often use separate soaps and towels for the upper and lower areas. Keep this in mind when placing things near the patient. Avoid placing anything on the bed below the patient's hips and always provide a drape or sheet so that the legs remain covered while lying down. Knowing that healthcare workers do not observe their beliefs, Romani patients may avoid using items touched by non-Roma, as they may see non-Roma as a source of impurity and disease. They may ask for disposable cups and paper towels and will want to be assured their medical equipment has only been used once. Accommodate these wishes as much as possible. In order to avoid uncleanliness, the Roma may often reject food from hospital cafeterias and elect to eat meals only prepared by their family. In order to gain the trust, respect, and further compliance of a Romani patient, try to accommodate for visitation. It might be prudent to bend the rules, such as allowing more visitors at a time, extending visiting hours, or providing a private room to accommodate the constant presence of their family. The Romani often consult older family members before every decision, even procedures such as blood draws, medications, and other diagnostic tests. Be sure to include older family members and treat them respectfully, as they are needed to ensure cooperation of younger family members. To avoid miscommunication and save time, it may be necessary to have the patient and family designate a spokesperson in advance. English is not a native language of the Romani. Avoid using medical jargon or complex technical terms. Ask if any of the hospital care or procedures will be in conflict with their religion. If so, gain information on this. ask why, and explain that it may be necessary for their health. When providing printed instructions, be sure to assess for literacy. Many Romani are unable to read, but do not assume that they are less intelligent. They are accustomed to dealing with complex policies. Many of the Romani may feel that hospitals and other healthcare facilities are hostile places and may only seek care when they are close to death. To the Romani, healthcare facilities are full of non-Roma and are unclean. Upon entering, they may feel exiled from their own society due to visitation rules and will suffer greatly rather than seek care. It is important that we as healthcare professionals be aware of their history, their cultural needs, and our own bias and behaviors to ensure quality and respectful care of the Romani. Thank you.